So, one of the toughest topics that I want to tackle, and I don't know where the future is going on this topic of medical insurance. I really think it's a misnomer to call it health insurance. It's almost like sick insurance. People don't use their insurance to be well. They use it in times of trouble and emergencies, in a situation where they feel really ill and they haven't been to the doctor in a few years. People aren't using their medical insurance for health, they're using their medical insurance when they're sick. And people are afraid to go to the doctor because of the bills. They're afraid to like rack and stack a bunch of medical bills and then not have an answer. So, what's happened in this country is that people don't go to the doctor for wellness. The important part of this situation is that our medical insurance costs us too much money. It takes a big chunk out of our paycheck every month, and we don't seem to be getting the coverage we used to. I can give you an example. Back when in 1980, when I had my youngest child, he was born premature by 11 and a half weeks. He was in the hospital a long time, and we had great medical insurance. I think it was through Prudential. I don't even know if Prudential does it anymore. And our bill was $30,000 for that 3 weeks, no, 6 weeks stay, and all of his ophthalmologists and specialists that came to see him at the hospital. And this was in the NICU, and he was there 6 to 8 weeks, and went from 2.5 pounds to 4.5 pounds and came home. But the bill was $30,000. I had an emergency C-section. Of that entire bill, we paid $600. Now, they audited that bill and they kept us on the phone making sure that every med that they had on there he got, and every service that they said was on the bill that he got. And once it was all done, it was 30 grand and we paid $600. There's no such thing anymore. Even with good coverage, having a baby, you're going to put out of pocket as much money as three to four times money that I put out to pay for my daughter when she was born, which was $3,000 cash. There's no such thing anymore, and people are afraid. So I'm going to explain really quickly. This may be a two-parter. I'm going to try. You need medical insurance. Medical insurance is supposed to cover those catastrophic illnesses you may have. In the old days, there was a cap on the catastrophic illnesses. In the Affordable Care Act, they can't cap you. So let's say you have a cancer situation where you reach $1 million on your deductible, or past your deductible, you reach $1 million. They can say to you, okay, we'll no longer cover anything for you in your health care. So if you had AIDS, which a friend of mine did, he had AIDS and he reached his $1 million, and the insurance company canceled him. And his brother, who was a very powerful lawyer, went and fought and said, no, you can't discontinue his health coverage. So let's be honest, the insurance companies have always been in charge of your medical care. They don't want to put out for sick people. They do not want to cover you if you're ill. They want healthy people only. Back in the early 90s, I applied for insurance through Kaiser, and I had fibrocystic breast disease, which is benign breast tumors. And they wrote me a letter and said, you are not the kind of person we want on our health care. So I was refused insurance back in the 90s because of that particular illness. Might have been a little later than the 90s. I am a little blocked on that, but I did not get health insurance from them. They refused because I had a pre-existing condition. What are pre-existing conditions when you apply for medical care? Anything that they consider to be something that is life-threatening or dangerous or expensive, they can turn you down because of it. So let's say you had a mild heart attack when you were 42 and you're now healthy and 46. In the old days, and possibly coming in the future, they can say to you, no, you had a heart attack, we are not giving you insurance. Or if we give you medical insurance, we are excluding anything that has to do with your heart. So There are millions of people, millions and millions and millions, I can't even tell you how many, that have existing conditions that medical insurance can turn you down for. Diabetes, heart disease, kidney disease, female problems, breast cancer, prostate cancer, urinary tract cancer. There are throat cancer, skin cancer. They have been given the go-ahead in the past to deny you coverage for any of those things. When the Affordable Care Act came through, it said, hey, do not discriminate against pre-existing conditions. And that's where the rub comes in. Everybody's premium went up higher. Why? Because what the insurance companies did is build in a little bit into each person's premium an amount to cover pre-existing conditions across the country. So maybe I don't have any health conditions, but I would be paying for someone who has diabetes, someone who gets pregnant, someone who has a heart attack. It's built into my premium. It's not like my record, my health record, gives me any jump up on health insurance premiums. They do it by age. So you'll say, gosh, I was 39, I turned 40, and my health premium went up. Why did my medical insurance go up? Well, you've now entered 40. The 40s are where these medical problems show up. So they charge you. You turn 50. Oh my gosh, my premium went up 27%. Why? Because you've now entered the premiums for 50-year-olds who now start getting diabetes and for sure, strokes, heart attacks, those kind of things. Then you are like me, you enter your 60s. And when you enter your 60s, you are now considered a problem. So your health insurance premium even goes higher. And so stop thinking that it's like auto insurance where, oh, I haven't had any accidents or tickets, so my insurance premium's low. They still charge you auto insurance by your zip code. So when you have your auto insurance and you live in zip code 90066, and 90066 has a lot of car thievery and burglaries and stuff, your car insurance is going to be fit in with all the people that live in 90066. Same with your health insurance. It goes by your age and where you live and what health insurance costs in your area. I have talked to so many people and I feel they're very naive about how medical insurance works. It is not about, oh, well, I've never had surgery and I've never had a heart attack and I've never had this or that. No, based on where you live and your age, you are paying for everybody else in your age group and the fact that there are risks. All of medical insurance is about risk factors. We need to understand that when we are debating the medical insurance premium issue and what healthcare will really cover. I am saying that healthcare should cover you to be well. You should get regular checkups. Everybody in this country should have a blood pressure a portable blood pressure machine to check their blood pressure. If their blood pressure is continually high and even a resting blood pressure, which means you've been sitting at a desk with your feet on the floor and your arms open, palms up, and you are sitting there for 5 minutes very calmly, breathing, and then you take your blood pressure. If it's high when you do that, you should be at a doctor, but most people won't go. So I think that the health insurance issue is going to be the biggest issue in 2017, and I want to be able to explain it. I want to be able to get people on that can help you make a choice, and I want the American people to be healthy, happy, and using their insurance the right way. And the fact that you can't afford it makes it the biggest issue around. Be healthy, be happy. Know what you're doing. Understand how it works. We can do this together, I promise. I'm 65, I'm on Medicare, and I'm finding out a lot. So go on this journey with me.